Hello everyone, welcome back to my channel Psychology Network. This topic is for psychotherapies which are given in the UGC Psychology booklet. It is under Unit 9 of Human Development and Interventions. They have given around 16 therapies. So, what is UGC expecting out of you? Do they want you to know all the therapies in depth? No, they don't. They just want you to know the principle of those therapies and who founded them and just few basic details about them, and that is exactly what I have given in this video. This is the part 1 where I'll be teaching psychoanalysis, person centered therapy, gestalt therapy, and acceptance commitment therapy. The over taught and over studied, I feel, is the psychoanalysis. Everybody knows it was established by Sigmund Freud, and Freud viewed therapy by making it unconscious to be conscious. Whatever is in our unconscious mind, he wanted it to bring it to the conscious, which then would allow the person to get rid of the neurotic symptoms. The fundamental treatment concepts which he gave was transference, resistance, and countertransference. Now, what is transference? Transference means when a person is going to therapy, the person might have certain kind of feelings towards the therapist. That is transference. What does countertransference mean? When the therapist has some feelings towards the client or the patient, that is your countertransference. Now, what is resistance? Resistance is when the person is laid on the armchair and she or he is told to say anything, whatever it is, whatever thoughts are coming to your mind, to let it free and just say it to the therapist. But they might have answers like, nothing is coming in my mind right now, or they don't know what to say. These are your resistance. That resistance are blocks which are not allowing the subconscious or the unconscious to be conscious. So, four technical concepts of psychoanalysis and psychoanalytic psychotherapy are important in the therapeutic process, which is the free association, which I just talked about. That when the therapist is asking the client to be, her real self and to say whatever is coming to her mind, that is free association. Whatever the patient is saying, the metaphors in the patient's words, that the therapist has to understand. And certain indirect behaviors in psychoanalysis are also psychoanalyzed. Like if the person is coming late to the psychotherapy sessions time and again, that it's an indication that there is resistance. Now, if the question comes, is transference necessary for psychoanalysis to work? Yes. Actually, transference is necessary for the psychoanalysis to work, because when there is transference happening, what the client is doing is that they are reliving their relationships with their significant others, which could be their parents, with the therapist. They are, what can I say, seeing the therapist as a whiteboard, and they are putting everything, all the feelings towards that therapist. So the therapist will psychoanalyze the kind of transference that is happening and understand what kind of relationship the patient might have had with their significant others, like the parents, or what kind of attachment she or he had. Now, again, the dream interpretation is a very important part of psychoanalysis. So, from psychoanalysis, also learn your ego, superego, and all the psychosexual stages. Next, we come to person centered therapy. Now, person centered therapy was given by Carl Rogers. It's also called Rogerian therapy. So, the centered therapy operates on the humanistic belief that the client is inherently driven towards and has the capacity for growth and self actualization. Now, person centered therapy is very much different from psychoanalysis. In psychoanalysis, the therapist has a higher hand, uh, but in person centered therapy, the patient is seen to be the equal as the therapist. The therapist functions under the assumption that the client knows themselves the best. Thus, viable solutions can only come from them. In person centered therapy, the therapist believes that all the solutions to whatever the problems the patient is having or the client is having, that would be given by the client itself. What the therapist will do is just guide the person towards the solutions which the patient already knows. Now, Rogers identifies six conditions that were very necessary and sufficient to facilitate the therapeutic change. First, therapist client psychological contact, which means the therapist and the client are in some sort of contact. Client incongruence. The client is feeling incongruence. That is why he has come for therapy. The client is not feeling himself. The client is incongruent. That is why he has come for therapy. Now, whoever is giving therapy is congruent. That is the therapist. That is the therapist congruence. That is why it is actually advised that therapist, before starting therapy, they should take sessions themselves. And in psychoanalysis, in fact, it's important that you take sessions for yourself for years and years before you actually become a psychoanalyst. Fourth, therapist unconditional positive regard. This is a very important point in person centered therapy, that there is unconditional positive regard from the therapist side towards the client. Now, therapist has to be empathetic. Whatever the client is saying, there should be empathetic listening and understanding towards the client. And the client perception, which is that the client perceives the therapist unconditional positive regard and empathetic understanding. Now, these six points, please keep in mind. Unconditional positive regard, an important thing. Person centered therapy is also called Rogerian therapy. That is an important thing. Person centered therapy also promotes self actualization in a non judgmental environment. These few points are very important, and definitely it was given by Carl Rogers. Then we come to the Gestalt therapy. Gestalt therapy was given by Frederick Perls with his wife Laura Perls, and it steps on the four theoretical pillars, which is phenomenology, because Gestalt therapy says whatever it is here and now. Whatever is happening in the moment is what is real. Dialogical relationship, that is, the therapist must be fully present and understanding and validating towards the client. And whatever the therapist is saying has to be authentic. Whatever therapist is saying has to be true and what therapist actually believes. Just because they have to give an empathetic understanding does not mean they can start lying to the patient. That is never there. Then there is field theory. That is the interaction of the therapist and his or her environment. Fourth, which is the experimentation. Gestalt experiments offer clients a chance to become involved in action based exercises that heighten their surrounding awareness. So, these are few exercises or experimentations. For each client, they can be different, and not all the experimentations would work for all the clients. So, and Gestalt therapy says that the processing should be internal and it should be focusing inwards. The main concepts are your figure ground, like figure ground as in the figure is the client and the ground is his or her surrounding. Is the surrounding overwhelming to the patient or not? That is something important here. Balance and polarities, there should be balance between attitudes of the client and awareness of the environment. This was your Gestalt therapy. Remember, it was given by Laura and Frederick Perls, and these 4 points and a few basic concepts. Now coming to acceptance commitment therapy, in Indian UG and PG syllabus, usually acceptance commitment therapy is not something taught, and again UGC does not expect that you know in and outs of the therapy of this therapy. Just want you to know the basics of acceptance commitment therapy. Now, it was developed by Stephen C. Hayes. It's very important, and questions do come that who developed acceptance commitment therapy or the ACT. Now, the basic definition, what ACT is saying is basically it's mindfulness based. From mindfulness based therapies, there are a lot of therapies coming out, like CBT based mindfulness. Now this acceptance commitment therapy is also mindfulness based. What the ACT sees as a problem, which usually clients have, patients have, that they want to control the environment. What acceptance commitment therapy states that the client should be accepting rather than attempting to control or change the unpleasant sensations. They should just be in the moment and see what's going around, and to let the moment pass. When you are trying to control the problem, that is an illusion, because nobody can control what is happening around you. The bad situations will come, and sometimes we have no control over them, and when we are trying to control and then we realize that we cannot control the situation, that is when there can be breakdowns and psychological drift from the normality. I wouldn't say normality or abnormality, but psychological drift from the equilibrium of the body and mind. So if control is the problem, how is ACT helping? ACT has few core processes, mainly six, which is contact with the present moment, which means to let the moment be, not to control them. Diffusion, values, acceptance, self as a context, and committed action. When you're accepting of the present moment and you're mindful about it, then there can be action, how you can move ahead from that kind of situation. But controlling is not the way, because most of the time it's an illusion. We cannot control things. And what happens through these six core processes, after that, the person can be said to have psychological flexibility. Psychological flexibility, as in the person, if the person is in a bad situation, it's not really letting it affect the person. If the person is in a very good moment, he is again not letting it affect him so much. He's flexible, however the situation is, he's flexible in that he's not controlling it, he's just letting it be. That is your psychological flexibility. So if you have any questions, you can put it in the comment section below. And I have covered four therapies in this video. There would be part 2 coming up. So subscribe to keep getting updated.